Oh, it's fine. They're always there. Hello. Welcome to our final presentations for the case competition. We're very glad to have you all in this Korea auditorium. I first want to introduce our the case competition team. That is Pratik and me. And then we have a liaison, Ryan, over there. And also want to introduce Erin, Suzanne, who are all involved with the case competition, and I don't see Josh. Josh is over there, okay, who were all in support of writing this case. And also want to give a shout out to Brad, who was also the part of it. We'll be starting our final presentations. We had 3 teams for this external round. I'm going to just name the schools, but you wouldn't know who are presenting. They were Duke, Simon, and UNC. So you'll see 2 presentations from these 3 schools. And we can start, I think. We're going ahead with team 1.
Okay, are you able to hear us in the auditorium? Yes, set a thumbs up. I can't. Okay. Sorry, is that? Are they able to?
You're not muted. So.
No. Sure.
No, you just fence this thing.
So nothing changed.
Okay. Okay. Start video. Okay, we're on live. Oh,
Yeah,
is that? Yeah, we're on the screen. Are you able to see our slides as well? No, I'll just start our body.
I think we're good.
See. I just see the Zoom right there. That's just
I think we're good to go. Right. Right time.
What do you want to do? Should we go or?
Let's go.
Yeah, I think we're good.
Okay, are we good to present? Oh no, there now. Our slides are on there. Perfect. I can see our slides on the Zoom now. Yeah, your message.
All right, I think we can get started. I think our slides are on their screen.
Okay.
Okay, they just missed.
Perfect. Thank you.
Fantastic. All right.
Great. First off, thank you for being here and allowing us this opportunity. When I started to think about the many neurological patients I've had over the years as a board certified specialist in physical therapy, I really started to think deep and ended up thinking more about my own grandmother who had a neurological disease process herself. We had to watch as a family her go through this devastating illness, the caregiver burden on both my grandfather and my mother, and also the financial impact of it. So this case really brought to us more of those feelings. Let me introduce you to my team from Apollo Consulting Group. Within this team, I have Eric. Eric was in patient quality and safety for the last 6 years. I have Mehul, who is in hospital operations for the last 4 years. And we have Verdun, who is in his last year of medical school and about to enter residency for anesthesia. What we will be going through today is going to be
just a moment, we can't see the slide transition, so would you
Okay.
mind sharing the slides?
Yeah. Technical difficulty.
Yeah,
Let's try.
apologies for that. The slides aren't changing yet.
They're not.
They're not.
Okay, let's try to fix that
Sorry.
quickly.
We can just stop the screen share and just try again. Is the clicker working?
What's that?
The clicker. Yeah.
Now we're good. Okay.
Okay.
Well, now after that small bump, let me reintroduce my team from Apollo Consulting Group. My name is Missy Kiesler. I am a board certified physical therapist in neurology, also a first year MBA candidate. I have Eric, who is in hospital quality and in healthcare quality and safety for the last 6 years. Mehul was in hospital operations for the last 4 years. And we have Verdun, who is in his final year of medical school, currently applying for residency in anesthesia. When we read this case, we really thought about how this is impacting all the patients that we've seen. And in doing so, we created a really strong recommendation for you. Today, we'll be going over the request for proposal, market valuation, care for you value proposition, and ESG integration. Let me give you a little background on Care for You Pharmaceuticals before we go into it further. They currently have patents for cardiovascular and endocrine. However, those patents will be expiring in the next 10 years. They would like to enter the neurological treatment space. They were established in 1990 with current private primary revenues coming from those patents, starting at $30 billion per year. However, they will be decreasing to less than $20 billion in the next 10 years. They also have a new CEO and CSO who are want to bring fiscal responsibility and social conscious decisions, making it forefront of the business. They also have ESG concerns and shareholder activism that are currently not being addressed. And so the current situation, the Apollo Consulting Group has been brought in to say is, out of 3 medications, which one should be brought to FDA phase 3 trial? Now, before we go into the medications and treatment processes, I would like to tell you a little more about the FDA drug approval process. The first one is the traditional phase pathway. This is when we think about phase 1, 2, 3, and 4, starting from small percentages of the population, maybe 20 to 30, growing all the way to phase 4, where there may be several thousand people involved. The next process is the accelerated approval process. This is for a significant disease process that may have no medication or treatment at this time, or we can prove through surrogate endpoints that we have a better treatment process or Care4U has a better treatment process. Finally, the orphan disease process. Now, this is for rare diseases that have less than 200,000 people involved within it, and it combines phases 2 and 3 and says that anyone has the appropriate criteria or the disease process can access it at cost. However, it is non-randomized and non-controlled. Okay, now let me tell you more about the medications that were proposed. The first one is for early onset Alzheimer's, ALZ-001. The second medication is for opioid use disorder, OUD-002. The third medication is for Huntington's disease, HD-003. Now, if we go further into Alzheimer's 002, for early onset, there's currently one competitor in the market. However, that one competitor is actually marketed to all types of dementias currently. And so we believe that we will be able to target early onset Alzheimer's with ALZ-001, but also use that dual indication, as previously mentioned, of accelerated approval process to be able to target the rest of the Alzheimer's population as well. When we talk about opioid use disorder, there are actual multiple competitors on the market in the pharmacological space. However, what has been shown to be best benefit is having that multidisciplinary approach with behavioral intervention. Therefore, we believe there is low demand in a saturated market for OUD-002. The third medication for Huntington's disease, HD-003. Now, this is actually a rare disease. There are less than 200,000 people in it, as previously indicated in the last slide. Therefore, it should actually go into the orphan disease designation and not for FDA phase 3 trial. And in doing so, we will be moving Alzheimer's for early onset ALZ-001 to FDA phase 3 drug trials. Eric's going to tell you further.
Thanks, Missy. So as Missy mentioned, we're proposing to move ALZ-001 to phase 3 of the clinical trials. There are 3 reasons for that. First, we believe it provides the greatest value to society. Second, it's the perfect fit for the Care4U value proposition. And third, it has the greatest future growth potential through R&D. So first, I'm going to talk a little bit about the market demand for these various interventions. You might notice that we also included late onset Alzheimer's on this slide. And the reason for that is, as Missy mentioned, we are going to likely pursue a dual indication for this drug. So we'll start by looking at the number of diagnosed Americans. Now, if we then look at the number of patients who benefit from the drug, but third, and the key aspect of understanding the market demand is really the number of patients who are expected to seek treatment. And when you look at all Alzheimer's patients, that's over 6 million potential patients. You might notice as well that for OUD, while there were 1.5 million patients who may benefit for the drug, only 525,000 we expect to seek treatment. And the reason for that is, as Missy mentioned earlier, that they may not be likely to want to seek treatment, or that behavioral interventions are of more of interest to that patient population. Next, I want to talk about per patient costs. Now, why are per patient costs important? It's because if we can target a drug that has the lowest per patient cost, we can then pass the least amount of economic burden onto our patients and families who end up paying a lot of these bills. Now, I want to draw your attention specifically to early onset Alzheimer's as well as OUD. For early onset Alzheimer's, the cost incurred per patient about $7,500 versus OUD almost $10,600. That's a 34% difference in those prices. The last slide I'm going to walk you through is potential savings or caretaker support time for these various disease areas. You're looking at a chart of the total yearly cost of caretaker support. In 2027, which will be the first year of the early onset drug on the market, caretaker support savings for early onset will be 7 times that of Huntington's disease. Further, by 2031, only 4 years after the ALZ drug is on the market, early onset ALZ will surpass OUD and total caretaker support savings, even accounting for the fact that the OUD drug could have been on the market 2 years earlier. And with that, I'm going to turn it over to Mehul to talk about ESG and marketing.
Thank you, Eric. When we've done our analysis of the options to move one of these drugs to a phase 3 trial and landed on Alzheimer's 001, we have done this from a perspective of societal benefit. And why are we doing this from a societal benefit perspective? And this is because environmental, social, and governance issues are at the forefront of decision-making for business resiliency of all publicly traded companies. McKinsey report recently showed that between 25 to 30% of all profits in the healthcare and pharmaceutical industries are at risk of being eaten away due to governmental regulations if companies do not address these environmental, social, and governance issues. Specifically within the pharmaceutical and healthcare industries, social issues are at the forefront. And when we look at the 3 drugs available on the market, the demographics of the patient populations play a large part in the decision-making process, as that translates directly into who can participate in the clinical trials. Alzheimer's provides the greatest value to patients in terms of the diversity of the patients that are affected by it, and that can then participate in the clinical trial itself, as these are and this diversity of patient population in the clinical trial are patients that have been historically marginalized by the healthcare system and the pharmaceutical industry. When we look at societal benefit of opioid use disorder and the Huntington's disease drug, we see that in opioid use disorder, that as we've talked about, patients are not always seeking treatment, but there are community resources and infrastructure already in place that we can support. In addition, as we've talked about, the Huntington's disease drug should be under the orphan designation process and could be considered an ESG investment separate from the movement of one of these 3 drugs to a phase 3 trial. And all this together, we're also recommending that Care for You revamp its value proposition to be a company focused on societal benefit to the development of successful pharmaceutical treatments. Your CEO and CSO have already committed to this, and you've already seen just how you can price socially consciously in the future for these drugs that you bring to market, and continue to show that through actions that you have already committed to this value proposition. This then allows you to create a marketing campaign, communication, and promotion of these actions in the future that also allows for shareholder engagement, especially with the fact that you've already seen your share of ESG activism at shareholder meetings. This activism has been in a hostile manner at a shareholder meeting without prior warning, but through these initiatives, including moving Alzheimer's 001 to phase 3 trial, with an investment in caretaker support in the opioid use disorder area, and moving Huntington's disease to the phase 3 trial, you can engage this activist shareholder at the C-suite level and set yourself up for success in the future. And now Verdon's going to talk about exactly growing the future success of Care for You.
Thank you, Mehul. As for our proposed timeline, in year 0, in addition to investing in ALZ 001, Care for You should invest in its internal research and development department to enhance its capabilities so that it can it is able to find these new drugs that will provide benefit for society. It should particularly invest in this so that at this time, so that before patents expire. And in year 1, research should be expanded to see whether or not ALZ 001 can be applied to treat other dementias, which, as Missy mentioned previously, is very likely the case. Concurrently, FDA accelerated approval should be sought for ALZ 001. And in year 2, pending approval of ALZ 001, a secondary FDA orphan drug application should be sought for HD 003. And this is due to potential cost savings and societal benefit. Now, there are 3 main stakeholders involved in this decision. It's the patients, Care for You, and the shareholders. From the perspective of patients, ALZ 001 will stand to benefit the largest number of people. Additionally, since Alzheimer's disease affects a diverse group of patients, clinical trials will be accessible to the minority population, which has traditionally been underserved in the area of clinical trial access. As for the shareholders, we propose a development of an internal form of communication to help highlight concerns and actions that have been taken by Care for You to address these. A key part of our value proposition is providing social benefit for patients and families as a whole. we propose an ESG initiative to help address concerns that have already been raised, including a project to support caregivers and the caregiver communities that have been affected by the opioid epidemic. Lastly, Care for You stands to benefit greatly from this proposal. With enhanced internal R&D capabilities, it will be able to find and discover new drugs that will have far-reaching benefits for patients and society as a whole.
In conclusion, thinking back to the patients that have touched each one of our lives and my own grandmother, we are confident in our conclusion to recommend moving forward ALZ-001 for early onset Alzheimer's to FDA phase 3 drug trial. Thank you.
Thank you so much. We'll now pivot to the next presentation.
Testing. Do we have the clicker?
Oh, sorry. I didn't look at it. Pointed out that one. See, I felt like, oh, yeah, you're good.
Care for You board, thank you for having us here today. I'd like to start by introducing our team. My name is Rex Halliburton, and I'm joined by my colleagues, Austin Harley, Emma Carlson, Macy Blake, and Sophia Fitzgerald. As part of your request for proposal, you tasked us with selecting one of 3 drugs primed for phase 3 clinical trials. There were a number of factors to consider when selecting this drug, but of the utmost importance was answering 3 questions. First, how would this drug propel Care for You into the neurological space? Second, would this drug be able to ease shareholder activists' ESG concerns? And third, how would this drug be marketed, both internally and externally, to best align with Care for You's new leadership's mission in creating a socially conscious and fiscally responsible drug development company? In order to answer these questions today, we'll start by first identifying the target market. Then we'll talk about the competitive landscape, provide you with our financial projections, discuss some new and exciting social initiatives, and finally, wrap up with some risks and recommendations. As Care for You prepares to take a monumental next step into socially conscious and fiscally responsible drug development, we at the Apollo Group believe that your name, your messaging, and your marketing need to reflect this mission. Because of that, we begin our proposal today with a suggestion that Care for You evolves into Care for All. This evolution hinges on 4 key objectives. The first is an entrance into the neurological space. The second, targeting of underrepresented markets. The third, reestablishing your historically strong revenues. And fourth, but certainly not least, increasing your social responsibility. Next, Macy's going to outline some key measurable outcomes that will help you achieve these goals.
Thanks, Rex. These measurable outcomes include affected population, addressing market share potential, revenue projection, and stakeholder satisfaction. As you can see, ALZ-1 adequately satisfies each of these 4 measurable outcomes, which contribute to Care for All's long-term goals. Because of this, we at the Apollo Consulting Group recommend that ALZ-1 be the drug of choice to move through phase 3 clinical trial testing. ALZ-1 has the highest efficacy rate, coming in at 95%, compared to 50% and 25% for OUD2 and HD3 respectively. In addition, ALZ-1 has a favorable market share potential and competitive revenue projections that my colleagues will discuss later on in our proposal. ALZ-1 will make the greatest impact and satisfy stakeholders' interests and concerns. Meet Judy, a seemingly healthy 55-year-old woman, a successful attorney, mother, wife, and caretaker to her aging parents. Judy's life was recently turned upside down after her recent diagnosis with early onset Alzheimer's disease. And unfortunately for her, there is no current low-cost drug therapy on the market to treat early onset Alzheimer's disease. She is now tasked with the unthinkable decision of whether to prioritize spending her life savings on an unreliable drug therapy or to watch her health deteriorate before her eyes. She fears today that she'll be unable to recognize her own face in the mirror, let alone remember her own children's names. Fortunately for Judy, she's heard about Care for All's ALZ1 drug that is up and coming through phase 3 clinical trial testing, set to hit the market with a 95% efficacy rate in the next 4 years.
Great. So how do we identify our affected populations? There are 6.5 million Americans diagnosed with Alzheimer's disease. We see 1 out of 17 of these individuals with the early onset variant, typically between the ages of 45 and 65. At these ages, many individuals, like Judy, suffer from a shocking diagnosis at an early age. For these reasons, we believe in developing a low-cost therapeutic for individuals commonly neglected by big pharmaceutical companies. We are continuing to see the rate of Alzheimer's disease deaths outpace the rate of heart disease deaths, creating a positive outlook for neurological R&D. In this space, finding a solution for our expiring cardiovascular patents proves promising. Up to 1 billion people worldwide are affected by neurological diseases, and many of them are lacking the proper treatments or even symptom management therapeutics they need. Certain social determinants of health, such as poverty, income inequality, and education, have important implications for health risks. Studies have shown an association between higher levels of education and lower likelihood of developing dementias. Additionally, African Americans are disproportionately affected by Alzheimer's. Despite being twice as likely to develop dementias, they are 35% less likely to be diagnosed with them. Additionally, we see these disparities emphasized even more in Hispanic groups. By implementing some key social initiatives, which we'll outline later, Care for All can help shrink these gaps when taking ALZ1 to market, helping all of these populations equitably along the way.
So now that Austin has identified a little bit more about the market composition, I'd like us to take a look at Care for All's potential to establish market share by analyzing its competitive landscape. When conducting our analyses, we identified 3 different aspects of this landscape to look at: the threat of new entrants, the power of buyers, and potential competitors in the drug pipeline. Looking first at the threat of new entrants, this is very low within this market as there are high barriers to entry within the neurological space, like time-consuming research and development processes, as well as FDA rules and regulations. Fortunately, ALZ1 has already hurdled many of these barriers to entry as it's primed to enter phase 3 clinical trials and will obtain FDA approval by the year 2026. Next, looking at the power of buyers, this is also very low within the market. With an estimated 13 million people suffering from Alzheimer's-related symptoms by the year 2050, as well as a limited number of market competitors, Care for All has a lot of flexibility when looking at its marketing as well as price-setting options. Therefore, we recommend that you, as Care for All's board, consider the objectives of your rebrand and give the power back to the consumers by creating an equitable and low-priced drug option. And finally, we analyze the potential and future competitors within this market. As of 2021, there were no drugs in the Alzheimer's-related space that had obtained FDA approval in more than 15 years. However, this does not mean that there are not nor will not be competitors that begin drug development in the Alzheimer's space. These potential competitors emphasize the importance that ALZ1 enters the early onset Alzheimer's market with a high market penetration, a low price point, and a high drug efficacy rate. It's also important to note that Care for All will not have a first to market advantage. This is because Biogen does have an incumbent drug, Aduhelm, which currently maintains 100% share of the early onset Alzheimer's market. However, as Sophia will mention here in just a second, Aduhelm is not necessarily suited for market competition.
Thanks, Emma. Yes, Aduhelm has faced major problems commanding the market share on their own, and they've faced these problems from the start. 10 out of 11 of the advisory panel members voted against Aduhelm's FDA approval, and 3 later resigned in protest of it. The EU has refused marketing authorization, and the Centers for Medicare and Medicaid Services have denied Medicare coverage for Aduhelm for their patients. Additionally, 89% of neurologists report concerns over Aduhelm's efficacy. Amid all the controversy surrounding Aduhelm, Biogen's CEO actually stepped down from his position. All the issues that Aduhelm has faced has resulted in little competitive landscape and fragmentation. This creates a large potential for market gain by going forward to phase 3 development with ALZ1.
So as Sophia mentioned, there are many gaps within the marketplace that have yet to be addressed by ALZ1's competitors. Examples of these gaps include not having a low-cost, highly effective option that inspires provider confidence when prescribing drugs for their patients, Luckily, ALZ1 is able to bridge many of these market gaps in a variety of ways. The first of which is that ALZ1 has the opportunity to enter the early onset Alzheimer's market at a competitively low price. This will give Care for All the opportunity to adopt a cost-focused competitive strategy moving forward. Additionally, this market penetration pricing will allow ALZ1 to enter the market and obtain a large percentage of this market share early on due to its competitively low price point. Next, ALZ1 has a projected 95% drug efficacy rate. This, in tandem with our first point, will allow ALZ1 to meet the gaps within the marketplace by being a low-cost, highly effective option, giving patients more confidence when considering their drug treatment options and encouraging insurance companies to cover this product. Finally, ALZ1 has a more niche focus. This allows ALZ1 to create market competition when it enters the early onset Alzheimer's market, increasing product innovation and driving down prices for patients like Judy to protect them from being price gouged by highly ineffective treatments. By looking at all three of these aspects, it's clear that ALZ1 is the socially responsible choice.
Thanks, Emma. Now we'll take a dive into our financial projections. So to begin, we've talked about this low-cost approach we're taking, where we're pricing ALZ1 at 40% of Aduhelm's initial price. This, in conjunction with a high efficacy and limited competition, will allow for early, strong market penetration. We're projecting this at 35% in 2026, and we expect that to grow to 53% by 2032. Taking a look at our P&L analysis, you'll notice a $500 million initial outlay in capital. This is going to include everything from preclinical trials through phase 3 trials and FDA approval. Then in year 5, we're anticipating your first year of positive profit at $1.7 billion, and we expect that to grow to $3.3 billion by 2032. Now we can take a step back and look at ALZ1's impact on Care for All as a whole. Based on your initial projections on expiring patents, you had your revenue dropping from $30 billion in 2022 to $20 billion in 2032. There we go. With the infusion of ALZ1 sales, we're anticipating a $5.6 billion delta in 2032 alone. ALZ1 will stabilize your revenue, but it will also allow you to reinvest into research and development in the neurological space. Additionally, we think you have an excellent opportunity on your hand to leverage these existing assets, OUD2 and HD3. Based on recent market transactions, we expect you could garner nearly $1.5 billion in sales of these drugs. Finally, when comparing ALZ1 to the other drug options, you can see that ALZ1's impact on net profit is comparable to that of OUD2 and strongly performs HD3. ALZ1 is the fiscally responsible option.
Thanks, Rex. Now let's talk about stakeholder satisfaction. As a team, we believe that ALZ1 addresses stakeholder concerns and will result in stakeholder satisfaction. Addressing stakeholder concerns is essential for Care for All's future success. And looking at some of our major stakeholders up here, they have very similar overlapping concerns. Providers want medication that has research-based evidence so that they can confidently prescribe to patients. Patients want medication that is affordable and effective. Payers want medications they know providers will prescribe and they know patients will buy. Finally, shareholders want medications that address their ESG concerns while maintaining revenue. ALZ1 is 95% effective, is entering the market at 40% of the competitor's initial cost, has steady revenue projections, and tackles an unmet need in the community. So the question is, how do we get the word out to these stakeholders, particularly patients and providers? First, relationship marketing and establishing strong relationships with key leaders in the field. We recommend Care for All do this by sponsoring a booth and presenting at the Alzheimer's Association International Conference. This will allow Care for All to inform clinicians about ALZ1 while also increasing brand recognition. Next, search engine optimization. By increasing Care for All and ALZ1's visibility online, it will increase recognition by both patients and providers, who, let's face it, are looking online for answers now more than ever. Increasing this familiarity is essential to breaking into these markets. Finally, utilizing medical science liaisons to create strong relationships with key opinion leaders in the field. ALZ1 speaks for itself with 95% efficacy. By providing unbiased, research-driven data, medical science liaisons are essential to educating clinicians on ALZ1, along with the potential benefits it has for their patients.
So in order to meet stakeholder needs and the shareholder needs that Sophia just mentioned, we at Apollo Consulting have created 3 different social initiatives to cement Care for All as a socially responsible company that truly cares about benefiting its community. The first social initiative that we recommend is that Care for All donates 1% of its total overall revenue back to both local and research-based organizations like the Alzheimer's Association as well as the LEAD study, which focuses on early onset Alzheimer's disease research specifically. When looking at the revenue projections that Rex showed us earlier, donating this 1% is going to have a negligible impact on Care for All financially. However, this amount will have a tremendous impact on these organizations as well as Care for All's patient population, establishing Care for All as a visible ally within its community. The second initiative that we recommend is that Care for All targets underrepresented as well as underserved populations. We recommend that you can do this by sending regional pharmaceutical representatives out to local FQHCs as well as rural health clinics. Additionally, we recommend that Care for All partners with rural pharmacy education programs like the one at the University of Illinois. By doing these two things, Care for All can ensure that there is a consistent supply of both pharmacists as well as healthcare resources to communities in need. The third initiative that we recommend is that Care for All takes a patient-centric focus. When patients like Judy receive their diagnosis, they have many different stressors and questions on their mind. Like, what does this diagnosis mean for me and my family moving forward? What are my treatment options going to be? And finally, how am I going to pay for these treatment options? By creating online informational resources, Care for All has the unique ability to be able to create a one-stop shop for patients like Judy, their families, as well as their caregivers to find the answers to their questions and alleviate their stress. Additionally, we recommend that Care for All implements feedback surveys to gain insight into its target market and make improvements to its products, increasing patient satisfaction overall. While ALZ1 will not hit the market until 2026, these social initiatives can begin today. These initiatives will address social determinants of health that the patients within Care for All's area of expertise are facing. These include decreased health literacy as well as a lack of access to both healthcare and pharmaceutical resources. By addressing these concerns, Care for All can truly cement itself as an organization that is socially responsible and cares about its community.
So, what are Care for All's risks and next steps? The first being stakeholder buy-in. It will be important for Care for All to cement themselves in the neurological field after previously holding drug patents in the cardiovascular and endocrine space. However, Care for All can capitalize on its previous drug failures because comorbidities between Alzheimer's disease, hypertension, and diabetes are common. As Care for All takes a step into this unknown market, it will also be important to establish key relationships in clinics with providers and patients, getting their feedback and concerns. And part of our proposal of the rebrand from Care for You to Care for All is to increase our brand recognition. And it will be important for the neurological data to be interoperable, meaning that others can use and access the data to contribute to Alzheimer's research because we need all the help that we can get. And lastly, looking at clinical trial feasibility. As we know, the FDA approval process is long and arduous, as it should be. However, by identifying candidates early on, like Judy, we can reduce and eliminate some of these long patient recruitment times. But it will be of the utmost importance for Care for All to accurately uphold the diversity of its clinical trial participants and accurately reflect the types of people who are afflicted with Alzheimer's disease. And lastly, Care for All will need to stay up to date with changing policy provisions like the Inflation Reduction Act, which can impact access and coverage to ALZ1 moving forward.
So now that Macy has addressed some of the risks and concerns with Care for All's rebrand, as well as bringing ALZ1 into the market, I'd like us to take a step back and look at Care for All's 10-year timeline. We've divided this into 4 different steps. The first is where you're at right now, with ALZ1 entering into phase 3 clinical trials, evaluating the selling of the patents of OUD2 and HD3, social initiative implementation, as well as external marketing efforts. Finally, this step will conclude with ALZ1 receiving FDA approval in the year 2026. Moving to step 2, we recommend that Care for All enters ALZ1 into phase 4 clinical trials. This will allow comparison between ALZ1 and other drugs like Aduhelm on the market, establishing ALZ1 as a top choice for patients. Our third step is that we recommend Care for All vertically integrates backwards, eliminating the need for CROs and bringing research and development back in-house. This will increase Care for All's flexibility and decrease its overall costs, allowing Care for All to enter markets where it wants and when it wants. Finally, in step 4, we recommend that by the year 2032, Care for All has begun drug development in the neurology space. This will establish Care for All as a key player in this area moving forward.
All right, so you've heard a lot. With our proposal, we would like to formally recommend that your company move forward with ALZ1 into phase 3 clinical trials. By entering the neurological space, we can establish ourselves in an emerging market targeting niche populations, giving more individuals like Judy the opportunity to pay for a more effective drug at a lower price than the incumbent, Aduhelm. We wanted to bring a proposal today that is not only fiscally responsible by having comparable revenue projections to OUD, but is also socially responsible by targeting the totality of our early onset Alzheimer's population. Aduhelm is not 95% effective. This is a market we can corner and help people in. By initiating stakeholders at every step of the drug development process, clinical trials, marketing, and rebranding, we can shift the image of your company to one that truly cares for all. And while ALZ1 is not projected to hit the market until 2026, the Care for All initiative starts today. There are many Judys, and there is a large need for early onset Alzheimer's therapeutics. ALZ1 may just be the start. However, together, this can be the beginning of something even bigger. Thank you for your time today, and thank you for your consideration.
First of all, thank you for this wonderful and, oh, we have Mehul here. So first of all, thank you so much for the participant teams, Team 4 and Team 1. And we have a consensus from our judges. Just to remind you that this was the final round. The teams did present before this. So our judges did have like a second view again. And with great excitement, I would say, at completion of this case competition, I would like to first invite the winning team. So the winning team for this competition is Team 4. And Team 4, just come over here if you can take the dais. And gives him great excitement. And our judges didn't know this. Team 4 is UNC. And the second team is Simon Business School. So Simon, kudos to you as well. Amazing presentations. And we really appreciate your insightful suggestions on a pretty real world problem that we are facing and we will be facing as we get into the weeds of gene editing, gene silencing. How do we make those decisions? So thank you so much, Team UNC, the winner for UNC Healthcare Case Competition 2022.
Well, I was just going to say that wraps up the day's events, but we're having a reception straight across with some drinks and snacks at the Keenan Center dining room. So if you guys want to join us for the next hour or so over there, please help yourself.
Sorry, one more. Oh, one more. This one better be really good. Do you want us to spread out? Oh, great. I can hear you. Yeah,
After he finishes, all the UNC Gilling students, we want to get a picture of him.
Thank you so much. Oh, yeah.
Good job.
Really appreciate it. Now, how do you want us to stay? Like dovetail? Do you want us to like dovetail it?
That works very well. All right, I'll come in this way.
Right here.
Thank you.
I stared into your eyes and everything went black at that point.
You're fine, go ahead.
No, you each get a check, your own check. Okay. So like what is it? So like I'll email y'all like Monday.
It's not the best idea.
I'll add first one,
Whatever program y'all are in.
MHA, Master of Healthcare
Good
Admin,
stuff.
and PharmD.
Just from a, like I said, from the practice standpoint, and we didn't know who was from which school, blur that out in the photo, but because we said we don't want to know. Message to me.
Oh, that's fine. Yeah, that's fine. Yeah, but just because I can still.
It became fun.
It's funny you said that. I remember being in this spot presenting to a full auditorium for something at a business school. I remember feel like it's like I blacked out. And what for me felt like it was 15 seconds of silence and I caught people after saying, oh my god, I did this. And I'm like, what are you doing? I didn't even notice.
That's perfect.
But
in my head, like you said, 15 seconds, 30 seconds.
yeah, it felt like, it felt like it just feels different. But like I said, well done, congrats. I can tell a lot of this into that. We collected feedback, which we're gonna written feedback, which we're gonna share. Reading of it from the handwriting skills.
That's okay. We can seek you out.
I took my name tag out with Chris Campbell. If you have questions on any of it, let me know. I can help clarify. Would you do this again somewhere else? Or?
No.
Thank you so much.
Uh-huh.
I know. Not a bad way out.
Really?
I can show up in person for
But
this.
like well earned. So
Thank you so much.
Have a great time. Job's finished.
I know. Oh no, trust me. I haven't eaten.
I mean, no problem. There are actually plenty of boxes that y'all can take, but we're having like a few. I do. I do.
Our first day's competition.
You know what I mean? But I'll email all y'all that. So I'll get you that and papers and stuff. But yeah. So I was gonna say, but you'll get.
Give you a break as well as us a break.
Yeah, but I'm trying to think. So it'll probably. Something like that. So I'm thinking $10 in the first one.
22, we did the math. We've already done that.
You've already done that.
We haven't done the math.
Yeah, I like how you're like, oh, what is it? You've been calculating.
I ran the numbers.
Yeah, no, so I'm ready. glad to have it.
I was gonna say, you really put the pressure on. Yeah, we were like, I know. UNC win.
Oh, I'm always one. I was good to do having it one year, just so it wasn't.
It doesn't look
But if we can bring it home every year, then yeah. So, come over, y'all remember?
I blacked out when I was using it, so.
Congratulations, guys.
No, it's true. Right.
Thank you so much.